So thoracic surgery is a field which deals with surgery of organs in the thoracic cavity, which is between neck and abdomen. So this is the thoracic cavity. Now robotic surgery is a method of doing surgery. So we take patient factors, the disease factors, availability of technique, technology, expertise, all these factors are taken into consideration.
Dr. Arvind Kumar doesn't need any introduction. He is Dr. B.C. Roy National Award holder, sir, and he's also chairman of Institute of Chest Surgery, Chest Cancer Surgery and Lung Transplantation and co-chairman of the Medanta Robotic Institute. Sir, my question, can you share your thoughts on the current state of thoracic surgery, lung transplantation in India?
Okay. So first of all, my very humble and sadar namaskar. So thoracic surgery is a field which deals with surgery of organs in the thoracic cavity, which is between neck and abdomen. So this is the thoracic cavity, which has lungs, two lungs, heart, food pipe, windpipe, 12 pairs of ribs on either side, a breastbone in front and a spinal cord or backbone behind. This is what forms thoracic cavity. Heart is a separate area which is dealt by a field called cardiac surgery, which is surgical side, or cardiology, which is the medical side. And when it comes to surgery for lungs, food pipe, windpipe, the area in front of the heart, area by the side of the lungs. So anything between neck and abdomen, excluding heart.
Right.
That is what is covered under thoracic surgery. Now, robotic surgery is a method of doing surgery. Now, let me clarify this at this stage only.
Right.
Conventionally, since the time surgery started, it had been done by open method, in which we make a cut in the cavity, which could be chest cavity or abdominal cavity, and that cut is made for you to be able to put your hands inside, reach up to the organ and then do the surgery and then whatever and come out, and then you close this cut. So the cut is not actually surgery. It's a step which is done to be able to reach your hands to the organ to be able to do surgery.
Right.
Now this cut has its own issues because so much of tissue is cut, whether it's a chest or abdomen, and healing and all other pain and all other problems are there. So people have been thinking, could there be a more patient-friendly way of doing surgery rather than making a big cut? And the breakthrough came in late 80s when a small camera was discovered which could be put on the top of a telescope. So instead of making a big cut, you make a small cut and you put a telescope with a camera inside, and you put small instruments inside, and instead of looking at the patient, you look at the TV monitor and you do the surgery by manipulating your instrument. So the surgery is same. Suppose I am removing a lung part for lung cancer. So whether I do it up open or I do it by this method, it's same.
Okay.
But the method is different. Here you are not making a big cut, you are just doing small cut. So it's called a small cut, or in chest we use the word video assisted thoracoscopic surgery or VATS surgery, and in the abdomen the word used is laparoscopic surgery. Here you hold the instruments with your hands and you look at a TV monitor, and that's how you operate. The drawback here is that when you look at the TV monitor, it has a length and a breadth, but it has no depth. So open surgery, when we do, we have 3D vision, but when we do this thoracoscopic surgery, we have 2D vision. So you lose the depth perception. 1, 2. When we operate, our hands have tactile sense and the fingers are very versatile. So you can move 5 fingers in different directions. So you have a whole range of movement and you have touch sensation. When you do a surgery holding long metallic instruments, you have less range of movement and you have no touch sense. So these are the drawbacks in the keyhole surgery or VATS surgery. In comes robot, which is actually not a typical robot that we think of, the humanoid, some human-like structure. Right. It's actually a 3-piece system. So there is what is called patient cart, in which there are multiple arms which are like a replica of human hand, and then there is a control unit, console, and there is a fiber optic cable which connects these two. So here, these instruments which were put in the keyhole surgery, which are held by your hands, they are held by robotic arms, and the surgeon sits on a joystick station and controls these movements by moving the joysticks there. So you have a robotic technology interfaced between the surgeon and the instruments at the patient side. Now this allows you to get 3D vision back, much better range of instruments, much better movement, and more finesse in your surgery than this thing. So this is how open surgery, VATS surgery, and robotic surgery is conducted.
Okay. What are the most significant advancement you have seen chest surgery and lung transplantation during your career?
Yeah, so chest surgery has undergone a lot of changes. Earlier, as I said, it used to be open surgery, and now majority of our work is done by using patient-friendly VATS surgery or robotic assisted surgery. So this has made a huge difference to the outcome of the patient. Pain is less, recovery is faster, hospital stay, ICU stay is less, cut is less, infection chances are less, and return to work is much faster. In today's world of fast movement and lot of work pressure, I think even if you save 2 weeks of leave off from your work, it's a huge difference. So today it's a in thing. The other development which has happened is lung transplant, which of course started in early 60s, but the real success came in 80s when the Toronto General Hospital team did the first successful transplant, and in the last 30 years lot of issues have been addressed, and today lung transplant is an established method of treatment for people whose lungs are irreversibly damaged and there is no medical or surgical remedy to bring them back to normalcy. For them, lung transplant is the only option today.
Okay, how do you decide whether a patient is a suitable candidate for robotic surgery, particularly in complex cases like lung cancer or thoracic conditions?
Yeah, so we have to look at various factors. The patient should be fit for surgery. The disease which is there, it should be such that you can actually remove the whole disease, and it should be possible to do it safely. So we take patient factors, the disease factors, availability of technique, technology, expertise, all these factors are taken into consideration, and then you take a decision whether this patient is an ideal candidate for robotic surgery.
Can you walk us through the benefits of robotic surgery in thoracic procedures and how it compares to traditional open surgery or video assisted thoracic surgery?
Yeah, so as I said, that this is a surgery in which you don't make big cuts. You make small cuts. So therefore, the first thing which strikes immediately is that the pain is much less after this surgery. The cut is less, so therefore the disturbance on the body, the trauma on the body is much less. ICU stay is less, hospital stay is shorter. Patients are able to walk from the day one. Patients are able to return to their normal life, go and join their job in maybe max 2 weeks time, which cannot happen in open surgery. The exposure of the healthcare personnel to patients' blood is less. Cosmetically, it is far superior because you don't get a big cut. So overall, there are a lot of advantages to the patients, and for surgeons, it allows an opportunity to do very complex maneuvers at difficult, inaccessible areas in the body.
How expensive is it?
So when you compare it to open surgery, the expense could be maybe 1 lakh to 2 lakhs more depending on which procedure you are doing. But then part of this is offset by shorter ICU stay, shorter hospital stay, less complications, less requirement for all kinds of medications. So in the long run, and quicker return to your gainful employment. So in the long run, if you see, it might even turn out to be cheaper than open surgery. Although if you just look at the bill, the bill will obviously be higher in robotic surgery. But if you look at the overall expense come inconvenience, I think the dice is in favor of robotic surgery.
Okay, okay. What type of thoracic procedures can be performed using robotic surgery, and what are the outcomes?
So anything which you can do at open surgery, you can do at robotic surgery also. If you have the technology, you have the expertise, the skill, and your patient selection is appropriate.
Okay.
So most of the procedures, of course, lung transplant where big lung has to be put inside is still something which is done by open. But when it comes to surgeries for thymomas, for myasthenia, for lung cancer, food pipe cancer, windpipe cancer, lot of tumors in the mediastinum, lot of other disease in the mediastinum, all of them can be handled better by robotic surgery. And as I said, it's a patient friendly surgery.
Okay.
Where the surgeon sweats more, but the patient has tremendous benefits.
Okay, okay. Okay, how does robotic surgery enhance precision and reduce recovery time of patient undergoing thoracic procedures?
Yeah, so in robotic surgery, the movements are very fine because you are moving joysticks, and those movements of joysticks through an optical cable are converted into the movements of the instruments. And there is a method of scaling down your movement. For example, if I move my hand 1 centimeter,
Right.
I can do 1:10 downscaling to the extent that my 1 centimeter movement makes 1 millimeter movement inside. It could be 1:1. I move 1 centimeter, instrument moves 1 centimeter. Or if I want to make it very fine, I could have a scaling of up to 1:10. So when you have to reach very deep inaccessible areas and do very fine suturing,
Right.
you could do this manipulation using the electronics there, allowing you to do very fine, extremely delicate movements and do surgeries with as much precision as in open surgery at deep areas. So therefore, many cases which might not have been suitable for keyhole surgery by the laparoscopic method or thoracoscopic method, they become suitable by the robotic method. It has tremendous application.
Right, right.